It is 1300. Let's call this Health Committee meeting to order. Speaker Sam, would you care to do the invocation, please?
Yes, Chair.
I'm sorry. Secretary Sam.
Dear Heavenly Father, Lord, we thank you for this day. We thank you for each and every one here today, Lord. We ask that you guide and direct the communications and the dialogue today, Lord. We ask that you bless each and every one here today, Lord. Guide and protect them as they go on throughout their day, Lord. And we thank you again in Jesus' name. Amen.
Thank you, Secretary. Shelley, would you please conduct the roll call?
Yes, ma'am. Sasha Black Fox Qualls.
Present.
Ashley Grant. Danny Callison. Julia Coates. Joe Deere. Kevin Easley. Uriah Grass. Lisa Hall. Clifton Hughes. Johnny Kidwell. Daryl Legg. Kendra McGady. Dora Petskowski. Cody Poindexter.
Honey.
Joshua Sam. Melvina Shotpouch. Condessa Teehee.
Honey.
We have a quorum.
Thank you, Shelley. If you've all had an opportunity to read the minutes from our regular session on December 15th, I'd take a motion. I have a motion and a second. All in favor? Aye. Any in opposition? All right, minutes approved. Moving on to reports from Cherokee Nation Health Services. We have Mr. Brian Hill with us today.
You may have about it. Did want to call out just a couple of highlights. During November, we had over 75,000 visits served. We also had 194,040 prescriptions filled. Did want to use that as an opportunity to talk about the new pharmacy app that is now available for download on the Apple Store as well as the Google App Store. That can assist with refills, medication reminders, as well as notifications via text message or within the app. Even before that app went live and we publicized it, some people were figuring out how to download it and using it. It seems to be very intuitive because people were already using it actually before we had the tutorial out. So I would encourage everyone to try and use that application because it does seem to be very successful and we're getting a lot of satisfied patient feedback. Also want to point out we had 92 babies delivered at Hastings during November. And for the year, for 2025, we actually broke a record. We delivered 1,112 babies at Hastings this year, so we're very happy about that. You know, and one of the reasons we believe that we're so successful is because of the people that we have. We just had a retirement ceremony for one of our LPNs, Claudine Arney, who retired after 43 years in the women's clinic. And that kind of commitment to our patients is really what makes labor and delivery so successful. Again, happy to answer any questions that you may have about the report.
Do we have any questions for Mr. Hill? Councilor McGady?
That's Chair. Do we have any numbers of the, like any data on the number of people who have downloaded the app just yet?
I do not.
Are we going to be collecting that?
I can get an
great.
update on that, yes.
Any other questions? Well, Mr. Hill, I failed to mention at the last meeting, but I just want to give a shout out to the Health Services Choir at the tree lighting ceremony. They did an outstanding job. I know they did that on their own time, but a phenomenal job by Miss Stephanie Wycliffe and the rest of the choir. So great job.
It sounded amazing. Thank you, and I'll pass that along.
I also just wanted to see if you wanted to mention anything about the health hiring event that's coming up.
Yes, I believe that is coming up on January the 16th. We're looking to hire a lot of new employees. We've opened up 150 new positions to help with the new hospital that's going to be opening up next year, or actually later on this year. And so appreciate the opportunity to remind people about that. That's going to be held at the Cherokee Nation Outpatient Health Center here in Tahlequah.
So will they need to bring any documentation with them to that?
The
What
more
do they need to be
documentation they
prepared?
bring with them, obviously, the faster that can make things go, but we'll do everything we can to make that a seamless experience for anybody who's interested.
Okay, thank you. Also, flu cases. I don't know if that would be you or Ms. Pivick to speak on. Are we seeing a rise in our flu cases?
Lisa may have specific numbers, but I can tell you that the answer in short is yes. There has definitely been an increase in flu cases. Fortunately, we got a lot of people vaccinated against it, which helps mitigate the severity of it. But I can tell you that you can see on even the November report, the inpatient admissions are up, and you can look at our top diagnoses for November, and already flu was, I believe, at number 4, number 5 in November. So yes, we are seeing a lot of flu cases right now.
Okay. Before you leave, I would like to visit with you about an opportunity for some Spotlight Hospital recognition that might be coming up.
Great.
All right. Any other questions? All right. Thank you, Mr. Hill.
Thank you.
And moving on to Cherokee Nation Public Health, Miss Lisa Pick.
Good afternoon. It's good to see everyone today. You have our report in front of you. I just highlight a couple of things on the report and then spend a couple of minutes briefly telling you about an upcoming change to some of our WIC distribution. The Stillwell Wellness Center, as you can see, if you look at the numbers, continues to exceed the numbers of participants coming to the Marcoma system, which can tell you that when we get the new building here in Tahlequah, that's going to lead to more and more. So that's a great thing to see, is if you have the capacity for the folks to come, they will continue to come, and we're really pleased, much to the staff there. The staff there is amazing in keeping people not only engaged, but enthused about the work that they're doing at the Wellness Center. So we're really excited about that. I do not have specific flu numbers. I can tell you, yes, that flu cases are increasing. I don't have those specific numbers. The public health nursing staff is still giving flu shots, and we're still getting requests for those out in the field, small events, here and there. They've given over 3,000 out in the field, and I know health has given, quite a few more than that, so we've increased that profile, so really happy about that. The one thing that I'll take just a little bit of time to tell you about is some exciting news. We are switching to an online system for WIC distribution of benefits, and this is going to be beneficial in several ways. Now, that will start next month. The process will start next month, and what that's going to do is going to allow us to be able to issue benefits without the person actually walking in with the card and putting the card in the chip machine, which is going to allow us to have more access at mobile events to sign people up right there. It's also going to pay our vendors quicker, so our vendors are happier. And so this process will start in February and be fully implemented by May. And so as people come in and get their benefits every 3 months, some will have the old card and then the new card, and hopefully by May everyone will have the new card and have all the benefits accessible. This also helps us if there's an emergency, if a family has an emergency or there's inclement weather or something going on, then we're able to fill that person's benefits without them having to travel unsafely to the clinic or emergency situations. So happy to answer any questions about anything going on that you've heard.
Any questions? Albina?
That'll be health services, and I can let Brian or Becky speak to that. We are giving flu shots specifically. Yes. Yeah. Yeah. We are offering COVID vaccines. Yeah.
Counselor Grant?
For the online program, how do they access that? Is it an app or?
So they already have a WIC. There's already a WIC app that people use. What this will do is just change some of the dynamics in that. And we've already been working individually with each participant coming in, showing them how to use and showing them when it's going to change. And we've just specifically made the old card and the new card look really different, working with communications, so that there's no confusion as time goes on of which is which. So.
Any other questions? I see none. Thank you.
Thank you.
Okay, moving on. Old business, none pending. New business, Counselor Hall, would you mind to take that?
Yes, Chair. This is a resolution confirming the reappointment of Cynthia Myers as a board member of Cherokee Nation Home Health Services, Inc. I want to note there is a Scribner error in the last paragraph. Beginning date should read February. I make a motion for its approval.
I have a motion. Is there a second? I have a motion and a second. All in favor?
Aye.
I'm sorry. I should offer Ms. Myers. Is she here? Would you like to come up and say anything? I'm so sorry.
Yeah, now that I'm here. Can you hear me? Yeah. Yeah, I do get to serve on the board for the Cherokee Nation Home Health. I think I'm going on my 4th year. It's been a great honor to watch and assist this group grow. I think we've near tripled business, so that's fantastic. And just to let everybody know kind of my background, I'm an RN and a respiratory therapist clinically, and then I also have my MBA. I currently serve as my position is Regional Director of Marketing for Oklahoma for MGM Healthcare, which is long-term care, skilled rehab, that kind of thing. And then just have been doing business development in healthcare for probably the last 22 years. Prior to that, it was cardiac and pulmonary nursing and respiratory therapy. So when I started this, it was just an honor. I've always wanted to serve and give back to Cherokee Nation, and this was an opportunity that I couldn't pass up, and it's definitely served to be rewarding, and I look forward to continuing to serve and help grow. So, anything from anyone?
Any questions? Very impressive.
Thank you.
Congratulations.
All right, we have a motion and a second. Let's do this right. All in favor?
Aye.
Any in opposition? Motion carries. Congratulations.
All right.
All right, and item B, Counselor Legg, would you take that, please?
Absolutely, Chair. This is a resolution confirming the appointment of Robert Stover as a board member of the Cherokee Nation Home Health Services. And I put that in form of a motion with noting a scrivener's error that should read February 2026.
All right, I have a motion. You have a second. Mr. Stover, would you like to come up and make any remarks?
That's all. Good afternoon, everyone.
Good afternoon.
Robert Stover, I go by Rhett as a nickname, so someone in the room may know me by that name. As Cynthia mentioned, it's been a pleasure to serve on this board for the last 3 years and a little bit of time, and you've got an incredible leadership team at the agency and some really passionate caregivers that have just done a phenomenal job, not only delivering services, but expanding the services and the touch offered in the home care setting. So it's been a privilege and an honor, and very thankful. So.
All right, thank you, sir. Any discussion, questions for Mr. Stover? I see none. Let's go ahead and vote. All in favor?
Aye.
Any opposed? All right, congratulations.
Thank you. Thank you, guys.
All right, item C, Counselor Grass, would you take that, please?
Item C, 26-003, a resolution to support a certain substance use disorder construction projects in Bonita and Tahlequah, and I put this in the form, utilizing opioid settlement funds pursuant to the PHWFA. Put this in the form of a motion. Is that correct?
I have a motion and a second. At this time, I would like to ask Chief Hoskin if you could come up, if you'd like to share any remarks.
Thank you, Chair. Just briefly, Council, appreciate in advance the support on this, as you know, and we have some folks here who can speak to it as you would like, but we have a project going on here in Tahlequah for our first drug treatment center for adults using the opioid settlement money. What this resolution would embrace is the expanded vision of that project and the addition of Bonita, where we acquired the former Veterans Administration Clinic, very good building that was simply vacated because the VA and the landlord couldn't come to terms. Of course, we know the rest of that story. The Cherokee Nation saved the VA in Bonita, but there was this building just a short distance, less than a mile from the health center. We acquired that. It's really perfect for an outpatient facility, so this would just be sort of further endorsement of the vision that we set forth in the Public Health and Wellness Fund Act to use opioid dollars to make the opioid industry pay for the damage that it did in the form of healthcare infrastructure. So those are the remarks I would share. Be glad to answer any questions. We do have folks here from Health and also Mr. Asbill to speak to any of the specifics that you might need.
Thank you, Chief. Do we have any questions? Counselor?
Chief, this is not so much a question as it is, I want to thank you and your staff for having the oversight to make sure that foresight to see that we have these in every aspect of the reservation, because we all know that, from Bartlesville, Bonita, South Coffeyville, it's a long ways to Tahlequah, and this will give people a much better chance to get to these places and to seek this help, and thank you so much for this. We appreciate this.
Councilman, thank you, and Councilor and Madam Chair, to the councilman's point, part of the phase of the larger vision of this treatment is transitional living, which of course is necessarily community-based, and so you'll hear us talk more in the future, come back to the council with updates on using some of those dollars that we've been talking about that phase of treatment. I am not an expert on the subject, but probably like many of you, you know it, you see it, you see people that are affected by it. And fortunately, we've got this amazing team at the Cherokee Nation and our health system and Mr. Asbill, who can take the things that lay people like myself see and feel and put it into real action, and appreciate the council's support on that. But rest assured, we'll continue to expand the availability geographically of these kinds of services. Thank you.
Any other questions? Councilor Paskowski?
Yes, and I may have neglected to remember this, but on the inpatient here in Tahlequah, can you speak to how many patients will be allowed at a time, or how will that work?
I'm going to defer to Mr. Asbill or to Mr. Hale still in the room, or Mr. Hale to answer those questions. Thank you.
Great question. The first phase is 50. We'll be in the initial phase that we're building now. The facility is able to grow kind of in interim steps to 80 and then eventually up to 100. So the first phase would be 50 inpatient, and then with the ability to expand in the future with future dorm facilities, living facilities.
Thank you.
You bet.
Thank you, Chair.
Councilor Callison?
Yeah, Mr. Hale, question. Will this facility we'll have in Tahlequah, will this enable us to not to be able to be dependent on sending people out of state and different places for this service, and we're able to do it ourselves?
With 50 beds, given our current rates of sending people out for treatment, we will likely still continue to need to send some folks out for treatment. One thing that we're also wanting to do here is have a little longer length of stay. Some people need a little longer length of stay. Typically, kind of the standard as far as payers are concerned is 30 days. So if you can't get well in 30 days, you're kind of have stuck. So because this is our facility, we're going to focus on a longer length of stay for those clients that need it. So because of phase one being 50 beds, building it out to go to 100, we will still likely need to send some people out, but it should be considerably less than what we're sending out now.
Any further questions? Councilor McGady?
Sorry. Thank you. Do you want to detail just a little bit of what the outpatient service is going to look like in Bonita, please?
Yes. So it'll be similar to the medication-assisted treatment program that we operate here in Tahlequah. It's currently housed within Hastings Hospital. Medication-assisted treatment is our primary means of assisting folks that have opioid use disorder. We have since expanded the MAT clinic into some other areas where we can help also with alcohol use disorder. But MAT is really a simplified way of saying what they're doing. What we've also built out here in Tahlequah and that we want to bring to Bonita is providing primary care to those folks as well. A lot of times the recovery center is the only contact these people are going to have with the healthcare system. So while they're there getting their Suboxone or whatever medication it is and counseling, we're going to also try and provide their wellness exams, eye exams, dental care as much as we can while we have them there.
Great.
So it'll be a completely integrated program with therapy, MAT medications, as well as primary care.
And allowing individuals to restore their health and wellness while being in a supportive group
Correct.
setting. So thank you so much for
Yes.
that.
Councilor Legg?
So how many, I guess I could ask, how many do you think per year that we send out or refer out to go through rehab? Or how many do we always have in rehab at one time? What do you think?
It's probably 60 to 70 a month. It kind of goes in cycles, but roughly I would say 60 a month. And I could get you some firmer numbers, but.
We're months out to even be able to see a counselor sometimes. It's so jammed up in our system. You know, not that it's our fault, it's just, that's how bad the addiction is here in the reservation. So, man, we're going to make a dent in this and do our best, I know.
Yes, sir.
All great questions. I'm loving the discussion. Anyone else? Okay, thank you, Mr. Hill.
Thank you, Madam Chair.
All right, we have a motion and a second. All in favor?
Aye.
Any opposed? Motion carries. Moving on to item D. Counselor Grant, would you take that, please?
Yes, I will, Chair. This is item D, 26-004, Cherokee Nation Nursing and Allied Health Education Center, an Endowment Act of 2026. I would like to make a motion with making note of the Scrivener error in Section 4, subsection B, which corrects the address of W.W. Hastings from 10 South Bliss to 100 South Bliss.
I have a motion and a second. I'd like to offer an opportunity for Chief Hoskin to come up to make any remarks.
Thank you, Chair, members of the council. I appreciate the consideration of not only this piece of legislation, but the two that will be heard at the Education Committee. Obviously, the singular focus here is the Nursing Act, but from a policy standpoint, these all work together. So this will be our largest healthcare education investment in Cherokee history if you take it in its totality. This particular investment will enable us to transition the Hastings Hospital as it is now, after we vacate it later this year, and turn it into this nursing and allied health education campus. In visiting with our health team that's been working on this for some time, and Mr. Asbill as well, the old Hastings, as it will be a state-of-the-art facility that can accommodate the nursing school that we'll describe a bit more, but can also be more than that. There can be additional educational programs provided in this facility, which to me is very exciting because it builds towards the future. If it were singularly about nursing, that would be building towards the future, because we know the nursing shortage that this state faces. By its own estimate, they need over 2,200 nurses every year for the next decade, RNs, I should say, just to meet what they believe the demand will be. That doesn't speak to the other staff and professions in healthcare that we have to address as Cherokee Nation, as a region, as a state, as a country. This will enable us to go further very quickly with our discussions with the University of Oklahoma, an institution that's ready to put a nursing school into and really be the flagship program in this facility. The folks in health can speak more precisely to what the educational components will be, but I can share with you that this will meet a particular need that we have at the Cherokee Nation and that we have across the profession, which is those who hold, for example, associate's degrees but are RNs wanting to transition into a BSN. This facility, this program will enable that transition. Those, as we go a little further along and we open up the facility, those that have some prerequisites, perhaps LPNs, can be on their way to a BSN. And eventually, and this to me is a really incredible innovation in the field, which is those who have some other degree but want to get their BSN can eventually, through this program, achieve that. So that'll help us meet a real need that we have, that I recognize, thanks to our staff and the leadership of health showing me the challenge that we have and the real opportunity. The other components of it, I think, are really important too. So over $5 million to the Cherokee Nation Foundation to into perpetuity make sure we have an endowment that can generate dollars, that can create scholarships for those who want to go possibly to this OU nursing school, possibly elsewhere. But the point is that they come back and work for us. So continue to build not only the pipeline, but to build the actual workforce that we need. And then beyond the $5 million, $1 million to career services, because we know a lot of the staff that we need are those who aren't needing degrees, but they need certifications. They need some sort of training, helping more of our citizens through career services. That'll be in the other piece of legislation. And then $1 million, again, this is not in the legislation in front of you, but just flagging that $1 million into our Scholarship Act for healthcare education and developing youth programs so that they can see these opportunities as they're perhaps in grade school today, because we know how quickly time passes. The little kids that you and I see around the communities, they're going to be taking care of us in the future, and to the greatest extent possible, we want the Cherokee people to be taking care of the Cherokee people. I can give you the overview, Madam Chair and councilors, and this is really important to, I think, all of us. We've got a great team here, though, that can answer some questions. And they've educated me a lot about what we need in nursing education, why this opportunity with the University of Oklahoma is really incredible. And I think one thing I'd like to address is the need is so great for nurses that there is plenty of work to go around. We've got a lot of great institutions across this region that are already working on filling that pipeline. Northeastern State University, Rogers State University, NEO A&M, where my mother got her associate's degree and became an RN, has a special place in my heart. We've got a lot of work to do. We need all the friends we can get when it comes to building this education workforce. One of the things I'll note is, and I think this should increasingly be our standard going forward, is we try to be very purposeful in this act that we do not restrict these scholarship opportunities to the reservation. Why? Because in some ways we need to build a regional workforce, and because I think we all recognize this, and from my vantage point as chief, I see it a lot. We go across the country, we see young people in particular see what's going on in our health system. They want to be a part of it, and they consider even coming home, even if this has never been their physical home. They have a real affinity for serving their people. And I don't think we want to shortchange ourselves by saying that the only folks who qualify for these dollars are those that live in the Cherokee Nation. There's a lot of talent out there, and we need all that we can get. Madam Chair, I'd be glad to answer any questions, but fortunately for me, I've got some great expertise behind me to pitch in.
Thank you, Chief. Councilor Deere?
Hey, Chief, we talked about this the other day, how this is a great thing. Because as fast as Cherokee Nation is growing with all of our new clinics and infrastructure, you know, employment's going to be something we definitely need to take care of elders and children in these hospitals, the new hospital, Claremore, Veneta, even in the opioid center. And we see our growth is exponential. It's crazy right now. Right. So when we talked about this, we're like, this is definitely going to fill that gap when it comes to healthcare. Healthcare is huge in Oklahoma, dealing with it. So I just want to say thank you. I think this is a great thing. Definitely going to support this 100%. Because healthcare needs to be filled in Oklahoma. We see people leaving to Texas all the time, getting the higher incomes. But if we can make it regional, that's definitely going to impact not just the people on the reservation, but everybody. So I just wanted to share that for a second, but thank you. Thank you, Madam.
Thank you, Councilor. And Madam Chair, just briefly to that, everyone at this table, I'm sure, has experienced this, and it's a fair question the Cherokee people will ask me and ask you when they see we building the largest hospital in Indian Country. The largest outpatient center in Indian Country is just a few years old. We're building drug treatment facilities. We tripled the size of Salina. The very fair question they ask us is, how are you going to fill that building? And the answer is, it's our toughest challenge. But because it's our toughest challenge, we have to ask ourselves, are we equipped to meet the challenge? And I know that we are. This will help us along that way. But I think we should welcome those questions. How are you going to fill all of the professions that you mentioned, Counselor? Well, we're going to do it by educating the Cherokee people, and we've got to be confident in that. I think this gives us a great deal of confidence.
Councilor Callison?
Yeah, Chief, you mentioned other things that the nursing that OU is going to do, is that like lab workers, X-ray technicians and different things? Are we looking into maybe training them as we move along?
Well, I think we're talking about other degree programs. One thing I would note is the very successful Surge Tech program will continue to be in Hastings. Of course, that's an in-house program, and that's why we call this the Cherokee Nation Nursing and Allied Health Education Center, where our key tenant will be the University of Oklahoma. Some of our health folks can speak more to this, and it may be a bit soon to talk about it, but I can tell you there have been discussions about future degree programs. I mean, when I listen to what our needs are, I hear physical therapy is a need, but I hear a lot of other disciplines are a need. And so I don't know, Brian, if you want to speak to the future.
Thank you, Chief. Some of the other things that we've discussed with some partners, and I don't want to give away anyone's business plans or anything like that, but we are working with other partners to look at how we can bring other educational programs in. Other big needs that have been mentioned that you all have talked about are medical laboratory professionals, radiology technologists. Those are kind of the next tier. We have been working with some partners to try and increase that pathway of those workers into this region. So. Yes, we are looking at other opportunities. It can't be just doctors and nurses and scrub techs. We've got to train some other folks too.
On a lighter note, will we be putting a really high fence in between the OSU Center and the OU Center there for maybe razor wire or something across there?
There's a lot of marketing opportunities available with this, yes. Yes.
OU Nursing School, absolutely.
All right. Counselor Grant. Counselor Grant.
Yes, thank you. I just want to echo what everybody else is saying. I am very excited about what we're doing to make sure that our health care is going to be able to continue, as we say so often, for the next 7 generations. Filling those jobs is important, making sure that we have people to fill those seats. And as a laboratory professional, I'm very excited and hopeful that that will be something that comes into that space eventually. I know how hard that lab team works across the board, having led them in the past, and how much they need help. So I look forward to seeing how those expand into other allied health professions. So thank you guys very much for having the foresight for our tribe and for our healthcare workers.
Thank you for that comment, Counselor Grant. And I was not pandering when I said we were going to offer an MLT program. But one more thing I would like to add when it comes to OU is the reason OU is a really ideal partner for this is that they have a strategic plan across the state that they've had for some time. The biggest bottleneck for the nursing workforce is instructors. And so by developing a cadre of BSN-prepared nurses, we will help address this shortage of clinical instructors and then developing people with the Masters of Science in Nursing so we develop more instructors. And that's going to really lift all the nursing programs in this region and across the state by creating more people prepared to be nursing instructors. So, hope that's helpful.
All right. Thank you all for your questions. Thank you, Mr. Hill, for that last part, because that was going to lead into a couple of my questions that I had. As a nurse myself, I am very excited to support nursing education. To see the LPN to BSN program being offered, that's great. The opportunity for MSN in the future is phenomenal. My question from a nursing standpoint, will this allow us to, again, offer clinical training for advanced practice nurses within our health centers?
That has not been contemplated as part of this proposal, no.
Okay. Any other questions? All right. Let's move on to our vote. Shelley, would you conduct a roll call vote, please?
Absolutely. Clifton Hughes? Yes. Johnny Kidwell? Yes. Darrell Legg? Yes. Kendra McGady? Yes. Dora Petskowski? Yes. Cody Poindexter?
Yes.
Joshua Sam? Yes. Melvina Shotpouch? Yes. Condessa Teehee?
Yes.
Sasha Black Fox Qualls?
Yes.
Danny Callison?
Yes.
Julia Coates? Yes. Joe Deere?
Yes.
Kevin Easley? Absent. Ashley Grant? Yes. Uriah Grass?
Yes.
Lisa Hall?
Yes.
Motion passes 16-0.
And Shelley, items C and D will need to go to special rules and full council tonight.
Yes.
All right, and moving on to announcements. Anyone have any health-related announcements? All right, I see none. The next meeting is tentatively scheduled for Monday, February 16th at 1 p.m. Take one more motion. Have a second. Meeting adjourned.